Thank you very much and welcome to this open day. Our cardiovascular and respiratory healthcare MSc is unique across the world because it's an opportunity to study both cardiovascular and respiratory system in the world's leading facility for doing research and healthcare on these two organs. So thank you. Next slide. Today, we'll take you through the overview of the program, how the learning works, tell you about how we do the research project, what happened to our previous students after they graduated, and then details of how to apply, and then you'll have opportunities to ask questions at the end. Do put your questions into the chat. We will save them up and then answer them at the end. So today's team is myself, the course director, Dr. Leanne Felkin, the senior teaching fellow, and Ryan Kelly, who is our program administrator. So here are our campuses, the Royal Brompton Hospital, the Hammersmith Hospital, and the main South Kensington campus. Most of the work will be at the Royal Brompton Hospital, very illustrious and storied institution, which goes back a very long time, and you will see its reputation at the top of the tree. At the National Heart and Lung Institute, which includes the activities at the Royal Brompton, but also extensive activities at Hammersmith and at Charing Cross. We have over 500 staff in the National Heart and Lung Institute, 4 fellows of the Royal Society, 22 fellows of the Academy of Medical Sciences, and hundreds of millions in research grants every year. We are the biggest teaching centre for medical undergraduates and cardiovascular and respiratory scientists in Europe. And we have over 200 PhD students, and if you join us, you'll be within a group of over 150 MSc students in various disciplines. Thank you. So here are photos of our recent graduates. Look how happy they are and delighted. This must have been quite early in the course, I take it. You took it, or was it right at the end? Was it at the end after they passed the exams? That's why they look so relieved. But here they are from all over the world, many walks of life, medical biosciences, sports exercise sciences, rehab therapy, nutrition, pharmacology, nursing, physiotherapy, respiratory therapy, paramedics, medical doctors, pharmaceuticals, and sports science as well. So very broad, and there's actually other ones as well, other scientists who've been there. So thank you. And they come to Imperial because of our world-class status as a medical science university. We're probably the #1 medical science university in the world. And we're the only UK program that combines cardiovascular and respiratory sciences in a single institution, the National Heart and Lung Institute. So we focus on clinical application of research knowledge, evaluate up-to-date research, and then work out how to implement this into evidence-based practice. So people who come are expecting to see how really the MSc is a research MSc, and then it looks at how this research can be applied into clinical practice. So we combine innovation and technology, and the focus is on improving healthcare. And you are aiming to learn real-world skills that you can enhance your career and help you get promoted into a more senior managerial or scientific role, rather than simply doing more of the same of whatever you are. So it should be transferable across many different disciplines. The research project is a very important part of the MSc, and you conduct it in world-class facilities with our world-leading experts who are internationally recognized in their fields. Thank you. So I'll now turn over to Dr. Leanne Felkin, who will tell you more details.
Thank you, Daryl. So good afternoon, everyone, and welcome. We're delighted to have you all here. There are a couple of familiar names, so I think we've interviewed some of you, and perhaps some of you are current offer holders. So I'm going to spend the next 10 to 15 minutes giving you an overview of the programme. I'm going to tell you a little bit about how we teach and assess our students here at Imperial College, and I'll also talk about your research project. When you're really excited about the programme of study that we have to offer you, we're going to outline our entry requirements and explain how you can apply to come and join us here at Imperial College. So the Cardiovascular and Respiratory Healthcare Programme was established in 2018, and we're now delivering it in its 7th year. The programme was designed to be flexible, and it can be taken as a postgraduate certificate, a postgraduate diploma, or the full MSc. Our students can choose to study full-time or part-time over 2 years. And each year we have 25 spaces available. We teach face-to-face on campus. Darryl told you the different campuses that we're based at. We're primarily based at the Royal Brompton campus in South Kensington, but we also visit the Hammersmith campus and the main campus up at South Kensington. The programme lasts for one full calendar year of 52 weeks. And for the academic year 2025 to 26, this will begin on the 27th of September. The structure of the programme we offer is modular. We have both taught and research modules, and as I said previously, it can be completed in 3 different ways: the certificate, the diploma, or the full MSc. Most of our students are registered full-time on the full MSc. All programmes undertake all taught modules, but the full MSc also requires students to complete the research project modules. Thinking about just the taught modules for the next few slides, these are split into core modules and elective modules. The core modules are compulsory and they form the foundation of your learning. There are 4 core modules. We also offer elective modules which allow our students to personalise their learning and their curriculum. Here, students will choose 3 out of 4, a choice of 4 elective modules. And students typically choose their elective modules according to their interests, but they also make choices based on the skills that they wish to develop and the learning experiences that they want to have. And I'm going to give you a little more detail about our modules on the next 2 slides. So if we start with our core modules, these form the foundations of our programme and reflect both our scientific and our clinical approach. The modules Foundations of Cardiovascular and Respiratory Sciences and Study Design have a more academic scientific approach, whereas Reflection and Evaluation of Clinical Practice and the module Quality in Cardiovascular and Respiratory Healthcare are more clinically focused. This slide summarises the key information about these modules, and it includes the number of teaching days and the assessment types. And I'll take you through these modules one by one. Foundations is the first module that we teach. It's a double credit module and it's led by Dr. Rashida Chowdhury, who is an electrophysiologist here at the National Heart and Lung Institute. The module will cover the anatomy and physiology of the cardiovascular and respiratory systems. There are 19 days of on-campus teaching and it's assessed with 2 assessments, a written assessment and an oral assessment. Study design is led by Dr. Andre Amaral. Andre is an epidemiologist at the NHLI, and in this module, you're taught the principles and practice of quantitative and qualitative research. The module has 8 days of teaching and will be assessed this year with an oral assessment. Reflections and Evaluation of Clinical Practice is led by Professor Elizabeth Renzoni, who is a respiratory consultant practicing at the Royal Brompton. The module teaches our students to critique clinical practice or the delivery of clinical practice in relation to evidence-based guidelines. And students learn how to reflect on their experiences and take action to improve the delivery of healthcare. This module has 3 days of teaching, but importantly, our students attend 4 clinics from across our partner hospitals to observe the delivery of cardiovascular respiratory healthcare, and then they use these visits to produce a portfolio of practice, which is their assessment. The last core module is Quality in Cardiovascular Respiratory Healthcare. This is led by Dr. Peter George, who is a respiratory consultant also practicing at the Royal Brompton Hospital. And here students are taught how to critically consider the factors that contribute to how we deliver high quality healthcare here in the UK. That has 5 days of on-campus teaching, and that is assessed with an oral assessment. Moving on to the elective modules, we have 4 elective modules from which students will choose 3. 2 of the elective modules relate to cardiovascular and respiratory healthcare, and 2 relate to respiratory healthcare. The first cardiovascular one is Innovations in the Management of Cardiovascular Disease. This is led by Professor Stuart Rosen, who is a cardiologist practicing at the Royal Brompton. This has 6 days of on-campus teaching with an oral assessment. The second CV focus module is Cardiovascular Health Prevention and Rehabilitation, which is led by Dr. Luxi Anafan, who is a cardiologist working at Hammersmith Hospital. This has 4 days of on-campus teaching and 2 days of remote teaching, and that has an oral assessment. Looking at the respiratory modules, we have Pulmonary Rehabilitation and Community Respiratory Care, which is led by Professor Nick Hopkinson, who is a respiratory consultant here at the Royal Brompton. He's also the medical director at the charity Asthma and Lung UK. That has 4 days of on-campus teaching with an oral assessment. And our final elective module is Respiratory Failure and Respiratory Support, which is led by Dr. Lydia Finney, again another consultant who practices at the Royal Brompton. That has 4 days of on-campus teaching, and that is assessed with a practical OSPE assessment. So having introduced you to the taught modules, in the next couple of slides, I'm going to show you how we fit these together into the academic year. So this slide summarises the MSc journey for a full-time student. It's a timeline. It shows you when the different modules are taught during the academic year. Our academic year starts in October with the core modules, Foundations and Study Design. They're about 2 weeks off for the winter break, and when we return in January, students undertake their elective modules, and the exact timetables for these modules will differ. They also complete the teaching for the core module reflections, and we start sending our students on their clinic observation visits in term 2. There's another short break when the college closes over Easter before we return for the summer. Here we teach the quality module, and students also begin their research projects. Some students will be finishing up their clinic visits for the reflective practice module as well. For those of you interested in the part-time MSc, this is split across 2 years. In year 1, you take the core module Foundations. In the spring term, you will complete 2 elective modules, and in the summer term, part-time students take the core module Quality. When they return to join us in year 2, in the first term, they take the core module Study Design. In the spring term, they take their final elective choice and the core module Reflective Practice. And then finally, in the summer term, they begin their research projects. So looking ahead to the next academic year, should you wish to come and join us here at the National Heart and Lung Institute, here are some key dates. It's expected that Imperial will host its induction week in the week beginning Monday, the 29th of September. Teaching on the MSc will start on Monday, the 6th of October with the Foundations module. The final assessment for the research project will be in September 2026, and then degrees are awarded in November 2026. Finally, our graduation ceremony takes place around late June or late May or early June 2026, and we celebrate here in the truly remarkable setting of the Royal Albert Hall, which is just behind Imperial's main campus in South Kensington and overlooks Hyde Park. An important question that we're frequently asked is how will I learn during my time with you at Imperial College, and how will I be assessed? Our teaching and learning approach on the MSc is very student-centred. We have multi-mode delivery. And what this means in practice is that we put our students at the heart of what we want to do in the classroom. And we've been able to keep the best practices that we've learned from recent years to deliver our teaching in a range of formats. So we still teach using traditional lectures and seminars, but we also use hands-on workshops, problem-based learning, journal clubs, clinical case studies, guided online learning and video tutorials. We also use a wide range of experiential learning experiences, which are a real highlight of the programme, and I'll expand upon those in my next slide. All of our teaching is delivered by our clinical and research specialists in the field, and is supported by a full-time dedicated senior teaching fellow. Finally, we assess your learning using a range of authentic formats, which allows you to showcase the knowledge and skills that you've learned with us. These include scientific report writing, oral presentations, poster presentations, case study analysis, and journal clubs. And we describe these as authentic assessments, as they are purposefully designed to replicate professional experiences that you will undertake in the workplace. This means that our assessments allow you to develop and showcase the skills that you will actually go on to use in your working life and your careers. Our experiential learning opportunities are a unique part of our MSc, which sets us apart from many other programmes here in the UK. Experiential learning means to learn through your experiences, and we're able to make the most of the truly remarkable facilities we have in the Faculty of Medicine and our associated hospitals to create learning experiences which cannot be accessed anywhere else. And our students frequently cite these experiences as highlights of the MSc for them. So, for example, we visit the Human Anatomy Unit at Charing Cross Hospital. Here we visit the Pathology Museum and also the Human Dissection Rooms, where Imperial's anatomists use prosections to show you the actual anatomy and how this differs from what you see in the textbooks. And this allows our students to experience and learn about cardiovascular and respiratory anatomy hands-on. Our students visit the cardiac catheterization labs at Hammersmith Hospital to observe our cardiologists and our cardiac physiologists at work. Some of our graduates are now working as cardiac physiologists in the catheterization labs. So that's a really nice circular experience for our students as well. In Imperial's newly refurbished teaching laboratories up at South Kensington, our students design and conduct an exercise physiology experiment for their foundations assessment. And lastly, we're especially pleased to be able to take our students to a scientific conference. So in November, as part of your foundations module, we visit the winter meeting of the British Thoracic Society. The BTS is the UK's premier society of leading respiratory healthcare professionals and scientists, and it's an opportunity for our students to hear the latest research firsthand and, of course, to do some networking. It's also an opportunity for our students to get a glimpse of their futures. Each year, research carried out by our students during their research project is presented at the BTS. And this year, one of our students from the academic year 2022-23 was there herself, presenting her own data that she collected during her research project. So moving on now from the taught elements of the programme to the research project. The research project is the capstone of our MSc. It's where our students can apply and develop all of the skills and knowledge that you've gained during the taught modules. Our projects are supervised by our academics here at the National Heart and Lung Institute, and during your project you will become embedded within their research team. You will take part in and contribute to the cutting-edge research that we carry out here at the National Heart and Lung Institute. And you'll be stepping up to work alongside the academics and researchers whose work you will have been learning about in the taught modules. We offer a range of different project types from both the cardiovascular and the respiratory fields. Our projects include clinical research, where you'll be collecting data from patients or healthy volunteers in the clinic. We offer laboratory projects where you'll carry out experiments in our world-class facilities. And finally, some students choose to do data analysis projects or systematic reviews of the literature. These projects offer more flexibility. And finally, students who are interested in improving healthcare, we can offer service evaluation and quality improvement projects. In some cases, we're able to support our students to develop their own projects, supervised by one of our Imperial academics as well. I'm going to move on now to talk about what happens next to our graduates. After we celebrate with them in the Royal Albert Hall, what do they go on to do next? Where do they go? So an MSc is a stepping stone, and it can open up many different and exciting opportunities for us. We now have over 100 graduates on our MSc. And it being a healthcare MSc, it'll be no surprise to hear that many of our graduates go on to pursue clinical careers or careers in healthcare. Each year, a number of our graduates go on to study medicine, either at undergraduate level or graduate level. Some graduates have joined the NHS Scientist in Training programme, which is extremely competitive, and they are now working as cardiac physiologists in the NHS. Our nursing students have used their qualifications to gain promotion and are now practicing as clinical nurse specialists. They have moved on to become research nurses or transitioned out of the NHS into the charity sector. Others are working in UK government healthcare posts, imagining and delivering the change in healthcare in terms of digital health and artificial intelligence. Many of our students also go on to do further study at PhD level, and currently we have 7 students undertaking PhDs just at Imperial College, these typically based on their MSc project. In addition to research, our graduates have embarked on educational careers as university lecturers, both here in the UK as well as overseas. And lastly, many of our graduates move into industry, working as project managers and in medical writing and so on. So I'm finally on to my last few slides, and I very much hope that what Dowell and I have shown you today has tempted you into applying to study our MSc here at Imperial College. So what follows now is some key information and the next steps that you can take. The entry requirements for the programme are an upper second class undergraduate or equivalent in a medical, biomedical or healthcare subject. If you speak English as an additional language, you will need to demonstrate competency in English by meeting the higher English language requirements. Applicants must also submit a personal statement demonstrating that the course is the right one for them, explaining their motivations for undertaking the MSc and the topic, and also showing that they have the skills, the knowledge and the aptitude to achieve the course requirements. Lastly, your application needs to be supported by 2 references. We guarantee an interview to applicants who achieve the first 3 requirements. If you do not meet the programme requirements, or if you are currently an undergraduate student who does not know their results yet, and we strongly encourage you to apply anyway, as your application will be assessed on its merits, and in such cases the personal statement can be pivotal. It may be that you do not meet the university's minimum requirements, which is a lower second class degree or a 2-2. And in this event, there is a special case procedure for applicants with sufficient professional experience to support their application. Lastly, we do not accept intercalating MBBS students on the MSc. In terms of the actual process for applying, applications for entry in October are currently open. Applications must be made online, and to apply you will have to register with My Imperial. You can submit 1 application form per year of entry, but you can choose up to 2 courses. There is an application fee, but we do have fee waivers for those who meet the criteria, so please do not hesitate to contact us on the MSc email for information about this. We review applications weekly and hold interviews twice a month. We communicate outcomes to our interviewees within 5 working days. And if you're successful, the university will make you an offer which will outline any conditions that you are required to meet. In terms of deadlines, the deadline for home applications is the 1st of August, and the deadline for overseas applications is the 30th of June. We close our overseas applications earlier to allow time for the necessary visa paperwork to be completed. And we do strongly suggest that you apply early, as we operate a waiting list once we fill up. This year, we're delighted to be able to offer 1 scholarship for the MSc. This scholarship will award £2,000 towards your tuition fees. The scholarship is available to both home and overseas students who will be starting in 2025. And to be eligible for the scholarship, you must hold an offer for the full MSc. The deadline for scholarship applications is the 2nd of June, and you can find further details about how to apply on our web pages. In addition to the programme scholarship, there are a number of other internal scholarships offered by Imperial College. You can search for these on the Imperial website using their search our scholarship tools. You will need to filter the scholarships by selecting postgraduate taught courses and the National Heart and Lung Institute. You can also search for external scholarships on this tool as well. Please do check the application deadlines for these scholarships. Some of them will have already passed for this year, and also do check the eligibility requirements. And this is my final slide. If you have not joined our mailing list, please do so. There's a link below and you can scan the QR code. I'm sure Ryan or Jen will be dropping a link into the chat as well. This allows us to keep you updated with the latest news and also key dates. So thank you for listening to Dowell and I. it's time now for your questions. I can see that you've been busy in the chat putting some questions in there, but just to start with, some people have submitted questions in preparation, so we will just cover these questions first of all, and then we'll start addressing questions in the chat. So the first question was, so I've grouped these into questions about the admission process, questions about the curriculum, and also questions about prospects. Some of these will have been addressed already during our presentation, but it's always good to repeat the key points. So the first question is regarding age restrictions for admissions with no IELTS. There are no age restrictions on admissions to the programme. And that's regardless of whether you do or you don't have to meet the English requirement. The second question is from someone who has a degree in cardioperfusion. Will I be able to pursue the MSc? Yes, absolutely. That's certainly the type of undergraduate degree which will provide a great foundation for our MSc. There's a question from someone who is undertaking an MSc in medical physiology who will be completing by December, and they're asking, can they join now or in December? We only have one point of entry for the MSc, so you have to be able to join us for the 27th of September 2025. The last question, please consider me for scholarships. Yes, please do. If you think you're eligible for the scholarships, apply via tick the box when you're making your application, and your application will be forwarded to the groups who evaluate our scholarship applications. The next questions are to do with the curriculum. The first question is, what are some of the ongoing research projects to note at Imperial, and how are mentors assigned for the research programme, for the research projects in the programme? So all of our research projects reflect the research that's currently ongoing in the National Heart and Lung Institute. So if you go to the NHLI web pages, you will find summaries of all of our academics and their research interests, and the research projects that we offer will align with those. Not all of our academics are able to offer a master's project each year. They may well have undergraduate students or just be at a point where the length of a master's project isn't possible. But by and large, all of our academics do offer projects. We assign mentors. We assign mentors according to what we call the Global Happiness Index. So we endeavour to make as many people as possible as happy as we can. So in practice, what that means is our students select, we have the list of available projects, our students select 5 projects, and they rank them from 1 to 5 in order of preference. And we then assign everyone their highest ranked project. Some projects are very popular, and say, maybe 4, 5, 6 students will apply for them, and in which case we will start looking at everyone's second choice project. The second question is, how is your collaborative work with critical care areas? So I'm going to pick up on the word collaborative there. So when it comes to the clinical side of it, if you have a project and you're undertaking research in an area of critical care, then it will be extremely collaborative for that student. Otherwise, your experience will be primarily through what we're able to offer through the reflective practice module. And the last question is, does this programme include basic echocardiography training? No, it does not, but We do offer. I don't know if this is a place to
No,
to
we
tell
can
you about
cross
our
advertise.
competitors.
Yeah.
We can cross advertise.
Yeah.
The National Heart and Lung Institute does offer the MSc in ultrasound with an echocardiography pathway, which is specifically to train cardiographers. So yeah, please do look on the web pages for that. Lastly, before we start looking at the questions that appear in the chat, in terms of prospects, what can you do with this degree as a non-clinical academic, and what are the possible opportunities and job prospects? So if you're interested in a degree in academia, then it's a fabulous foundation for a PhD and further study that way. So PhDs are certainly possible opportunities. Sometimes students may not be sure if they want to commit to a full PhD, but they're interested in research. So many go on to become a research physiologist. To be honest, in almost all cases, they've enjoyed their experiences so much that they then upgraded to further study as a PhD. But if you're interested in research, this is an excellent place to start. Yeah, and similarly, what can you do with this qualification if you're not a nurse? You can certainly move on to research. Our students have gone on to, as I say, to become cardiac physiologists, research physiologists. Many of them are working in industry. We invite a lot of them back, actually, particularly from our early graduates, to come and teach on the course. So Lucy Funnell is now working for NHS England, working to help deliver AI projects. So it allows you, when you're able to converse both clinically and in terms of research, when you're fluent in both of those types of language, you can go to places like NHS England and government organisations to be able to drive such projects like that forward. Okay, Daryl, have you got anything to add just here, or should we?
Yeah, I was just looking at the questions, and so people were asking about the IELTS. Yes, they do require IELTS, unless you meet the exclusion and you meet the exemptions, even if your previous course was in English. And the so this is a good one. I don't know the answer to this. For the £2,000 program scholarship, can they use the same personal statement, or do they need to do a different one? Leanne, do you know how that one works?
I believe you need to. No, I don't know. Actually, I'm at the risk of passing on misinformation. I would need to double check that. I think you might need to make a case for the scholarship, but
yes. So the personal statement maybe, So check, because I think the personal statement isn't just you want to study this subject or what excites you about the subject. It's more about why you require the scholarship and why that's a sort of good long-term investment for Imperial, that you're going to make something very good of yourself from it. So the key question is whether the people who review the scholarship applications also get the whole application. That's the key thing, because if they do, then it would definitely be, so maybe we can ask Jennifer or one of the admin team to tell us, does the whole application get sent to the people who assess the scholarships? Because if they do, then it is important to make it very different to show that you're making an effort.
Yeah, so the team that will review this NHLI scholarship will have had access to their main program application already.
Fine.
So yeah, it needs to stand outside of that.
Yeah, so don't just submit the same one. Not only do you have to change the balance of what you talk about to be more about why you deserve the scholarship and why you are going to do something better with it than other people, but also, even if some of that information is common, try and word it a bit differently so that they can see you've made the effort.
Right.
So another question came: if the research project requires patient evaluation, is this possible? Yes, some of them do, and that is routinely part of it. So sometimes there is patient interaction, sometimes you use laboratory data or previous patient data. But yes, that will depend on the project.
Yeah. Okay, so I can see one. What qualities or experiences make an applicant stand out for this program, especially if they come from a clinical background in a lower middle income country? I think enthusiasm, motivation, and curiosity, really, for me. You know, a drive for why you
want to do a research thing,
yeah.
why you want to do something that is research, yes.
Yeah, I mean, it's a stepping stone. I mean, for all of you, you know, when you're considering an MSc, you know, this one or elsewhere, it really is a stepping stone. So for you to know how the MSc will get you to the next place, you know, is really important. So if you're enthusiastic, if you're motivated, and your passion for the topic comes through, that's always engaging. Right. After completing the course.
Yes, are there placements, kind of employment placements afterwards? No, the course is really a research training course. And afterwards, most people have a wide variety of things they go on to. Either they find a PhD or they look for a research assistant post, or they go to work in clinical activities. But this degree doesn't give you an immediate placement afterwards. No, that's not how this course works. It's a research training MSc.
Yeah. I saw a couple of hands up when I was speaking. I hope you've had the opportunity to put your question in the chat, unless anyone's feeling brave enough to voice a question. Scrolling down to make sure that we've so how will the interview be? So you'll be set a task. So we ask the structure of the interview is same for all of our applicants. We ask the same question, and you'll be given a task to help us evaluate your critical thinking. Any more than that, I think, will be giving too much away. But they're online, and they're usually about 15 to 20 minutes.
Okay. Oh, there's one more.
So Mohammed's asked again what type of task to be more specific. I think we're going to be given a little bit too much to us. So yeah.
Yeah, you'll be given some task which will be similar to the sort of task you'll be doing during the course to assess your aptitude, because you're all describing ourselves as people who enjoy research and are keen and observant people. So we'll be giving you a task that involves demonstrating those skills that occurs within the interview.
And Lord has asked, should we mention the project we plan to develop in an interview?
If you have a plan in mind,
yeah,
that's absolutely fine. It's not necessary at all, because we expect people to come and then choose a project from those available. But if you have one in mind, that's excellent, and you can then develop it very quickly. And so if there's if there's a project that you want to do that's not on the list of official projects, by all means, find an appropriate supervisor and go to them and say, this is what I want to do. And I'm sure they'll help you develop it if it's a sensible idea.
Yeah, projects do have to have an imperial supervisor. So that's one, yeah.
Okay, so
Okay.
thank you very much. And if you have further questions, just drop an email through and we'll be pleased to answer. Thank you very much and best of luck in your applications.
Bye, everyone.